So you are getting melasma, you're having trouble with pigment, you are not alone, and I'm covering it all today. This is the only video you're going to need. In fact, you might download it and watch it a few times because I'm covering all about melasma. What are the two main causes? Can you get it from your TV, from LED light? What about from your computer or cell phone? And wouldn't you like to have this result? How do you prevent it? Most importantly, how do you treat it? With skincare, with exfoliants, with lasers. So you can get the same results I get in my clinic, but in the comfort of your own home. And yes, I do this in real life. This is what I do for a living. I answer to my patients. How many people do you listen to? Think about it. When's the last time they've held a laser, they've treated a patient, or you've seen their before and afters? Maybe not, but they're giving you your advice. I'm here to give you the advice and my exact formula of exactly what I do for melasma. A lot of this applies to general pigment too. Let's dive in. Okay, let's get a solution to your melasma once and for all today. Now, this is a very common and troubling skin condition. In fact, up to 33% of the population might get melasma at some point, and it happens more often during the women's reproductive years, and it rarely occurs, luckily, during puberty. Most commonly, I see it occur between the ages of 20 and 40. Pregnancy is often a time when it first occurs, the mask of pregnancy. So who is most likely to get it? Well, fair-skinned people are less likely to get it. People who have brown or darker colored skin are more likely. And if you tan in the sun, that means you have melanin, that puts you at risk for getting melasma. Of those who get it, only 10% are men, 90% who get this are women. So what's actually happening here? Well, your skin is made up of 3 layers. The outer layer, the epidermis, the middle layer, the dermis, and then the deeper layer, the subcutis. Your skin is an organ. It's actually the largest organ in your body, and it makes up 1/7 of your body's weight. Your epidermis contains cells called melanocytes, and they store and produce dark color pigment. That's the problem. They can produce it. This pigment is known as melanin, and in response to light, to heat, ultraviolet radiation, and hormonal stimulation, the melanocytes produce more melanin, and that's why your skin darkens. Unfortunately, this is a typically chronic disorder, meaning if you get it, it's typically lifelong. It's something that you're going to control. It will wax and wane. The good news is there are things you can do to control it, and there are things to do to prevent it that we'll talk about today. So there are 2 main pathways: hormonal changes and sun exposure. Now, there are no known health risks associated with melasma, but the uneven color leads to a lot of distress and self-consciousness for my patients, and I know for many of you. For these reasons, it doesn't need to be treated. Like all of aesthetics, it's desired to be controlled and treated. When I say sun exposure, really it's radiation, whether it's ultraviolet visible light or infrared light. Other possible and less common causes that you want to keep in mind are seizure medications, birth control pills, estrogen replacement, genetics, hypothyroidism, LED screens. Yes, I did say that. Think lights from your television, laptop, cell phone, tablet. You see computer screens, phones, and laptops, even TV screens, they emit blue light, which can make melasma worse. So what are the signs of melasma? Well, it causes these light brown or bluish patches of freckle-like spots in the skin. Sometimes these patches can even become inflamed, and that confuses the situation even more. Melasma appears in 6 locations or in a combination of these locations on your skin. Let's go through them. Number 1, brachial, meaning your shoulders and your upper arms. Number 2, central facial. It appears on your forehead, your cheeks, your nose, and yes, the upper lip, that mustache of melasma that people absolutely hate. Number 3, the lateral cheeks. Now, usually in this case, it will be bilateral or on both sides. Number 4, malar, meaning it occurs on your cheeks, but also on your nose. Number 5, mandibular, which is the jawline. And number 6, the neck. This is an interesting one because often I see people who are about 50 or older and they come in with brown spots, typically on both sides of the neck, and they're puzzled. But yes, this is melasma. Now, I know you're going to ask me in the comments below, so I'm just going to answer it. Is it affected by what you eat or by different foods? Quick interlude before we move on. I actually do answer my questions in the comments below. I'm happy to answer yours. Let's keep going. At this time, as far as we know, the answer is no. Now, I know a lot of you watching my channel are females and you're tuned into your thyroid, meaning you get your thyroid levels checked every year. What about melasma? Well, definitely those with melasma are more likely to have thyroid disease. So you want to make sure you get it checked by your primary care provider if you have melasma as part of your workup. And no, just the TSH will not work. At the end of this video, I'll put a link to a video I did on lab tests that your doctor's not ordering. I go through the complete thyroid panel in that video. Now, if you're not sure if it's melasma or not from what I've talked about and from the history, how do we diagnose it in the clinic? There's a couple things you can do. You can use special lights like a Woods lamp, which is a black light, and you can see kind of changes in the color of the skin. If we're really questioning what you have, sometimes we'll do a skin biopsy and that will give us the answer. So what are some of the natural treatments that people like and work well? My patients report back to me all the time because this is a common problem. They've tried things like turmeric, aloe, papaya, almond oil, and yogurt, all with some levels of success. I find that if you're using these kinds of treatments, the results take a little bit longer and they work best if you're using them in combination with the more aggressive treatments I'm going to tell you about now. Now, the first and primary thing you're going to want to do as much as possible, this is tough, but you want to avoid the offending agent. In this case, the two I talked about, sun and hormones. So prevention is absolutely key, and as we go through each section, I'm going to go into much more detail on prevention, but I am focusing this video on treatments. But what are the actual treatments? Number one, I like chemical peels. Now you're looking for ones in combinations. We're talking like the Cosmoland peel, or better yet, a VI peel. I'll link a video to me doing a VI peel below this video. These are combination peels and they contain top ingredients for melasma. Think TCA, lactic acid. Glycolic is probably the #1 top ingredient people use for melasma because you can titrate it up easily and it comes in varying doses. Also consider azelaic, kojic, and retinoic. The VI peel in particularly has retinoic acid in it. If you take the VI peel as an example, there's 12% TCA, 0.1% retinoic acid, 12% salicylic acid, 12% phenol. There's vitamin C in there, of course, and a mineral blend. And those ones like azelaic, I have complete videos if you want more information on those. Pretty much anything in aesthetics you want to know, keep in mind you can go into Google and type in Rajani and that product, like Rajani azelaic acid, and it will populate with many, many videos that I've historically made. But that's what should run through your mind in terms of peel ingredients. Why combinations? You just don't want to be aggressive with any one ingredient. And if there is an ingredient that's going to exacerbate it or make it worse, you don't want that in a high concentration. Combinations are best. Number two, add an exfoliant to your skincare routine. We know exfoliation is key for smoothing your skin, also minimizing dark spots, and it just so happens, of course, melasma is a type of dark spot. So physical exfoliation can work well. You can't be too aggressive here. You have to think long term, not like you're going to try and physically exfoliate it all in one day. And exfoliation works in combination with these treatments we're talking about today. Next, a retinol or retin-A. So many say, is it good? Is it bad? Will it make it worse or better? Vitamin A derivatives increase your cell turnover. It also helps rejuvenate your skin, of course, and produce collagen while you're at it. Depending on your level of melasma, you might be able to get away with simply a retinol, which isn't that aggressive. If you have stubborn dark spots, you may consider the prescription retinoic acid. My retinol A here is particularly well suited for melasma because it has a retinaldehyde, a retinol, and a retinol palmitate. It therefore kind of has a timed release because each one converts to retinoic acid differently. I know many of you are already on a retinaldehyde, and that's great. That's going to be the closest thing you can get to a prescription strength. But remember, just because you may get a prescription strength, that might be too much for most people because you just don't want that inflammation. So the key is get on a product that doesn't cause a lot of inflammation. I actually put avocado oil in mine because that's very soothing. Very easy for you to do if you don't have access to mine or you're on a different one. You can pair it with a skin oil, a soothing skin oil. And I have complete videos on skin oils. The key is no inflammation. A lot of times I'll prescribe a combination of retinoic acid, hydroquinone, which we'll talk about in a moment, along with a mild steroid. That combination is very common. You can get a compound. There are some over-the-counter preparations, but that's a very good product to use. You just have to be concerned. Your sun exposure really needs to be minimal because you can make your skin a little more sensitive to the sun, because that combination, when you add a hydroquinone and a vitamin A derivative like the retinoic, can really make it sensitive, especially with a steroid on top of that. Steroid decreases the inflammation, but a lot of people try and get so aggressive that they're inflamed, and then you get so much photo damage, sun damage, and worsening of your melasma. So it's a great combination, that triple. Just be mindful, you don't want to overdo it. Now, dermaplaning is a form of exfoliation. Many people, I know you guys do it and use it, whether your esthetician does it or you do it. It is a form of exfoliation, and it works well in combination with the skincare we're talking about today and the chemical peel. As the chemical peels speed up the cell turnover, the dermaplaning helps exfoliate that outer layer. As it does, the pigmentation goes with it and helps clear up the skin a little bit faster. Again, not too aggressive here. Hormonal balance is absolutely key to talk about because it is one of the main offenders. People who are on birth control pills may need them adjusted or substituted to a total different form of contraception. Just coming off of the medication or changing the dosing can take care of the complete problem over time, or with these creams and exfoliations. As the melasma goes, it might not ever come back again if you're not exposed to the estrogen, progesterone, the combinations. So consider changing your contraceptive method. You want to minimize hormone exposure. But that's absolutely a treatment to consider, because as people struggle with the melasma, they may change their mind on what form of contraception they're willing to accept based on their outward skin and how frustrating or difficult the melasma is. Here's a great one, and it's a vitamin C. You really want to consider adding a vitamin C to your skincare routine. Vitamin C helps decrease melanocyte production. So whether you have melasma or not, it helps clear the skin. And by decreasing this production, particularly in melasma, it works well. These vitamin C preparations are effective yet gentle on your skin. Many people try and use very acidic, potent vitamin Cs, and what happens? It flares up their melasma. New school vitamin Cs can be much more gentle, even moisturizing, yet effective. That's what I like about these two choices. As a benefit, it also helps build collagen, but there are two vitamin Cs that I really recommend for melasma. Number one, my own. There's 3 types of vitamin C in there, RajaniMD. Another good one is Revision's vitamin C correcting complex. I think both of those aren't too aggressive as straight vitamin C acids that are going to flare up your melasma, but more so they're gentle and long-term. One unique product you're going to want to know about is Anti-Age's Brightener. I use that a lot because it's very gentle on the skin. It uses peptides, tranexamic acid, but also growth factors. So if someone's at risk for hyperpigmentation or melasma and I'm doing a procedure, the growth factors help the skin heal quicker, and therefore we can decrease the risk of melasma or pigmentation problems. This mixes very well with other products that you may be on, so there's no interactions you need to know about. I use a lot of it in clinic and post-procedure, but people thereafter, they purchase it because they notice their skin gets clearer, it helps other brown spots, and it keeps their melasma at bay. I'll put a link to that one in the description below because it's unique. You might have trouble finding that one elsewhere, and you can read up on it at my store. Now let's tackle hydroquinone itself. It can be used alone. You don't have to add a retinoic or a steroid to it, but it is a controversial product, and you'll find in some countries it's banned. Personally, I look at the data. I'm very comfortable using it. It works very well for melasma. It used to be, in fact, over the counter here. Now it's prescription. That was one of the fallouts of all the safety worries. And so to get it, often you need to find a provider. What do I use? An 8%. It's a compounded version I provide to my patients. So we start there. And again, I might add the steroid. I might add the retinoic to it. But standalone as an 8% with peptides works very well. So if you have access to a hydroquinone, it's definitely used for melasma, and I would say a staple of care. Now, while we're talking skincare, sunscreen, of course, plays a vital role. Sun blockers are absolutely key. Hats, glasses, you want to avoid the sun, but it's almost impossible to avoid it totally. And you want to wear your sunscreen if you have melasma, especially in the daytime too. Anytime there's a hint of sun exposure, even if it's cloudy. A lot of times, unfortunately, people with melasma, they have to use blockers. So they look for physical blocking sunscreens that contain some level of zinc or titanium. And of course, you're always looking for SPF 30 or higher. And yes, if you're astute, you did notice my sunscreen is back up on our website. It was available in clinic for the last few years, but not on the site. It should be up within a week or so. People love it because you don't get a white cast, it doesn't sting your eyes, and it leaves the skin feeling silky smooth. Enjoy. Okay, now let's talk a little bit about lasers. You're going to hear from people, and you'll probably see in the comments of this video below, some people are going to say, hey, I did this laser XYZ, it cleared my whole face from the melasma. But for as many people that are cured by the laser, we'll use the word cured or cleared at that moment by the laser, there are also that many people that it makes worse, and that's devastating. IPL is a good one to consider because you can start very low. You're going to need to purchase a series. You start low, you build up, and you see, is it going to help? Is it not going to help? But if it makes it worse, you're not getting that level of heating with an IPL that's going to make it devastatingly worse. And by the way, this is me running the laser. I operate lasers in real life, so I'm bringing you real information. Let's go. But nor can you go in for one of these treatments. It can be frustrating and it can be a bit expensive. So you have to work with your experienced provider to up the levels over time. The problem here is heat can cause pigment and the light can cause pigment. So you got that double hit. It's just that some people do well with these and some don't. Before considering any IPL or laser, I always pre-treat them if I can. Hydroquinone's your number one. Number two would be anti-age brightener, especially for those with sensitive skin. But pre-treatment is key. And I think for me, if people fail the peels and the skincare and they're just getting melasma, say a flare up every year, and then it kind of fades as maybe the winter comes, they don't get much sun, or they're not exposed to hormones on a steady level, and the creams have failed them, that's when I will start to use a laser or an IPL, slowly introducing it to see how they respond. But there's no magic wand here. There's no magic bullet that this laser treats melasma in all people and it works well. It's all about heating, settings, and doing a series and building up. With lasers, it's all about trial and error, seeing an expert, and starting with cautionary settings. What's a cautionary setting? A low level of heat and light. Let me know in the comments below what's worked for your melasma. We all learn from those comments. You're now going to want to watch this video on 4 supplements for skin glow and tightening.